Hello, my name is Brenda Hernandez, and I'm currently a student at Pacific College for the BSN program. The purpose of this video is to speak about effective communication in the nursing or medical field. So we can begin by saying, what is communication? So in my own words, communication means an exchange of information. It can be within ourselves or between another person, you and another person. But there's also, different forms of communication. For example, written is one form of communication, verbal, and nonverbal. So one other way that we must communicate is what's called interpersonal communication. So believe it or not, it is actually quite common for people to talk or speak to themselves. Have you ever found yourself, in a situation where you're walking around looking for something and you say, oh, where's my keys? Or you say something like, when was I supposed to do that? And someone will say, who are you talking to? Well, you'll be happy to know that interpersonal communication is quite normal and is actually necessary for a healthy mental status. So it can even be used as a pep talk. You tell yourself, come on, you got this, you can do it, you're going to be okay, One thing that we can remember or we can try to ask is, when does communication start? So I was doing some research and I found out that when you're actually in vitro, in the womb, as early as 18 weeks of pregnancy, the sense of hearing, it has begun. And so that leads you to, understand that human beings are actually aware of others, and a sense of starting communication begins before you're even born. It's also been, heard that our sense of hearing is possibly one of our last senses to go. I've found myself many situations where a patient is in his dying stages, and it is very comforting to tell the family to, speak to the patient, tell him your goodbyes, and to let them know that although they're not speaking, although they're not moving, the patient can still hear you. So this is why effective communication is very important at work, especially in the nursing field. So I'm gonna mention a couple of tips that I can add to remember. One is that in order for communication to be effective, one person has to be listening and the other person has to be giving the information. So two people talking at the exact same time will not be communicating, because both are giving a message, but both are not hearing or receiving the message. So that's one tip. Another tip to remember is always keep in mind who is your audience, what is your purpose of communicating, and your tone. So the reason I say this is because your tone of voice can tell a lot. Two people can be saying the exact same thing with very different tone, and this message can be interpreted in two different ways. The reason I say, one tip is to remember what your message is. One important thing to keep in mind is always think before you speak, because even in situations where you want to say things that you probably shouldn't say, it would be best to think before you speak. So let's say, for example, if you, as a nurse, have to speak to your patient, it's important because if you want to communicate effectively, this is the moment where you build trust with your patient. And if they feel comfortable enough, they're going to start to open up and trust you. As a nurse, you have to give information to the doctors. So you're kind of filling in the bridge or filling in the gap. Have you ever heard of the saying that says, a nurse is a doctor's eyes and ears? Well, this is exactly what we mean.